Have you heard of antibiotics? I bet most of you have come across this word when you or your near ones have fallen sick. But what actually are these medications? Have you always used them when only required? Hi, welcome to Care Capsule MD, where we try to simplify health one capsule at a time. Today we're discussing about antimicrobial agents. But before that, let's dive into the basics. Let us divide all the existing diseases into two halves: non-communicable diseases and communicable diseases. Today's focus will be in the communicable diseases. There's an epidemiological triangle that describes three basic factors responsible for all disease transmission. This includes host, environment, and the agent. Host refers to any susceptible individual, and agent refers to the microorganisms which infect the host. And then, environment refers to the external condition that plays a role in host and agent interactions like climate, sanitation, living conditions, etc. Now let us shift our focus on microorganisms or the agents. These are the bugs mostly invisible to the naked eye. Broadly, these organisms can be divided into viruses, bacteria, fungi, and parasites. Many of these microorganisms are responsible for causing diseases to humans. For instance, COVID-19, influenza, dengue, etc. are caused by viruses. But infections like tuberculosis, typhoid fever, cholera are caused by bacteria. But then, not all microorganisms cause diseases. There are plenty of harmless microorganisms also. Some even stay in our body and then they get nutrition from the food we eat, and in turn, what do? They maintain minute ecosystems in our body and also fight against the potential harmful microorganisms that may try to invade our body. So, microorganisms can be both potential friends and foes. Now, the substances or the medicines which inhibit or kill these microorganisms are collectively called antimicrobials. It includes antibiotics, which are used against bacteria, antivirals, which are used against viruses, antifungals, used against fungal infections, and antihelminths, effective against worms and parasites. Antimicrobials are a group of very sensitive medications which has to be used with caution. The decision to whether or not to use antimicrobial agents, the choice of these agents, the doses, and the duration of treatment depends on several factors like the organism causing the infection, weight of the infected person, organ affected by the infection, coexisting diseases, and much more. So, the choice of these agents must be based on physician's discretion after proper evaluation only. Not all diseases and not all infections require routine use of antimicrobial agents. But over-the-counter availability of these antimicrobial to the public in many countries and their improper use has given rise to serious issue, which is antimicrobial resistance. We will discuss furthermore on this topic in our next video. Till then, stay safe, stay tuned, bye-bye.